always liked our providers. We always had excellent care from our providers, but it was very difficult to actually see our actual provider unless it was the yearly physical that was scheduled 365 days ago. If we needed a sick appointment or something like that, we never knew who we were going to get. And you didn't have that relationship. So if I felt that I needed an antibiotic because I had some kind of bacterial infection, they would say, well, let's wait another 2 weeks and then come back. Whereas my regular doctor would be like, oh, this is John. He knows what he's talking about. If he says he needs an antibiotic, I can give him one. He's not going to abuse it.
Important point.
And the other, hard part is like he had said, is not seeing your provider. And then a lot of times the practices have turnover. So your provider leaves. And then you don't have that consistency and that relationship that you have with someone who's with direct primary care.
So I had a decent situation. I was seeing a Dr. Barrett in Manchester. Manchester's a very affluent town. So the care there was decent, but I won't say it's as bad as some other people I know as far as getting like herded like cattle. Like, I think the average doctor spends 7 minutes with a patient. I think he spent
Roughly.
10. I wouldn't say the care was terrible, but it's a whole different beast with Dr. Gold. Like,
Won't go too much into detail, but I tried again. As I said earlier, we're sort of brainwashed. So it's still, even though I was kind of learning about the DPC, we still harbor this sort of, oh, well, if it really worked, like why wouldn't we have heard about it? And that doesn't sound. I'm going to go back to the safe sounding prominent health system. And so I went to another one, tried to get an appointment, showed up on Monday after, they scheduled me 2 weeks out, packed waiting room, sat there literally, this is probably over an hour. I had taken time from work until every last person in that waiting room had been seen or was gone. And now it was just me. And it was around noon. And I'm like, and I went up to the desk and there was nobody. They went to lunch. And I stood up, I said, hello, is there anybody here? And this is, and I turned around and I walked, I said, the hell with this. And I walked out and I got in my car and I drove to work. And that was my second attempt. And then I got a voice message that afternoon. Oh, Dr. So-and-so is he wants to reschedule you right away to come in. I never called him back.
Fortunately, I've been very healthy. Didn't go to the doctor a lot. I had some in my late 30s. I got quite heavy and wasn't as healthy. And then my mother, unfortunately, died of a heart attack at the age of 59. And that prompted me to get healthier. And I began to run and exercise and take more responsibility for my health.
Sure.
And that I did pretty well up until that started in 2007, 2008. Did pretty well up until about 2016. And in 2016, I didn't go to the doctor much, but I got to an age, I need a yearly physical. I need a relationship with a primary care doctor. And I'd gone to the doctor probably once a year for the previous, 5-6 years. Sometimes I'd go a couple of years without going to the doctor. And it became, I go to the doctor, and because I didn't go that often, I would have 3 things I'd want to talk to the doctor about. And, unfortunately, our doctors are trapped in different systems. I'd see the doctor about 3 or 4 minutes, 5 minutes. And before I could go, hey, doc, I got this other, they're gone. And so my wife and I, that's kind of the care. And usually it would be half a day to go to the doctor. It's going to sit in the waiting room 2 or 3 hours, in the exam room 30 minutes, 45 minutes, waiting to see the doctor for 5 minutes. So that's kind of my experience before direct primary care.